All right, today we want to talk about acute bronchitis and how to treat it. What has changed in 2025 and beyond in management of acute bronchitis? Now, by the way, acute bronchitis is just inflammation of the lining of your bronchus. And sometimes this will produce a cough with or without symptoms. So the main symptoms of acute bronchitis is a cough, which can be with or without sputum, that is the phlegm that is produced. Now, what sort of things have changed at this? Number one, the color of the sputum does not determine if this is bacterial or viral, because most patients come to us and they say, yes, I'm coughing, the color is green, and so give me antibiotics. And that is where the fight comes in, because you have to spend the time to educate your patients, and that's what I'm doing right now, to let you know that the color of the sputum does not indicate whether this is viral or bacterial. Now, the second thing that you got to be aware is that the cough can last up to 2 to 3 weeks, okay? If you have a viral bronchitis, which is mostly the cause of the bronchitis that we experience during the autumn and the winter season. And the reason I'm doing this video is that very soon we are entering into the season, and many people have those cough, and they'll be going to their urgent care or their primary care doctor's office, and most people are demanding antibiotics. And usually will tell you, yes, my doctor gave me antibiotics the last time, and so give me an antibiotics. Now, the studies that have been done most recently is that an antibiotic only shortens the course of the cough for about a few hours, not even a day. But we know that every antibiotic has a side effect. So the first thing is that the color of your sputum does not determine if you need antibiotics or not. The second thing is that the duration of the cough can be up to about 3 weeks. Okay, up to about 3 weeks, you should give yourself time that some of the cough can last up to about 3 weeks. And sometimes we call this post-viral cough syndrome, and the cough will last and keep people awake, and that's why they keep calling the doctor's office asking for antibiotics. So if you are a healthy person, you have no other comorbidities or any other chronic diseases, and that reduces your immune system, then when you have acute bronchitis, what you need for the treatment is symptomatic management. And that means drinking a lot of water, a lot of hydration. And also, if you have a lot of fever, low-grade fever, you can take some antiparasitic like Tylenol, ibuprofen. So basically, those are the things you need to do. In fact, the most recent studies have shown that the cough mixtures that we have over the counter, they do not work. They're just a waste of money. They don't shorten the cough duration. They actually do not do anything at all. In fact, even honey, pure honey, is better than in any of these cough syrups or cough medications that we see over the counter. When you go to the aisles, you see a lot of them. Don't waste your money. You can use a cough syrup like honey. You crush onions and you put you chop onions, and then you put the honey on it, let it stew overnight, sieve it, and take that. That is even better than all the cough syrups out there. Okay, so the most treatment is symptomatic management. Now, when you have what we call tachypnea, your breathing is more than 20 per minute. You're breathing, or you are having your heartbeat is racing over 90 beats per minute, and you're having a fever over 38.5 degrees centigrade that has lasted for about 4 days or more, or you are feeling shortness of breath when you take a little short, take a little walk. You feel short of breath, you can't breathe. Or if you have what we call the pulse oximeter at home, that little thing you put on your finger, it tells you the percentage of oxygen saturation. If it's less than 94%, then you should be going in and have somebody examine you because you could be having a pneumonia. And that is one of the things that we want to differentiate acute bronchitis from a pneumonia. So if you have a pneumonia, we cannot diagnose that over the phone or over a video call. You need to go in and get a chest x-ray because it is a radiological and a clinical diagnosis. So if you have any of the symptoms I just mentioned, then the new consensus is that don't do a video call, go in and get an x-ray. And if you have a pneumonia, you should be treated with antibiotics. Now, there are also a new development that they use something called the CRP. CRP, so it's the C-reactive protein. And in fact, some of the consensus on the studies are showing, especially in Europe, that if you have bronchitis and you're having a cough lasting, 1 week, 2 weeks, not going away, and they test your CRP level, is a blood test that is done, and if it's elevated, then you could be given antibiotics. But most doctors in Europe especially are using this these days to differentiate those who need antibiotics versus those who do not need antibiotics. So that is the most consensus for 2025, the CRP. In the United States, not all physicians are using that. The pattern of treatment, it varies from doctor to doctor. That's one of the things that if the urgent care or the ER has that CRP level, they can check that. If it's high, then they can give you antibiotics. Now, another thing that a group of people that really need antibiotics, I'm going to talk about on this video because I think I've gone long on this. So the next video, I'm going to share with you what group of people need antibiotics for acute bronchitis 2025 guidelines. I'll see you on the next video. Subscribe to the channel, give me a like, and share your experience here in the comment section, and so that together we can have a healthy lifestyle. Again, Dr. Moses, I'll see you on the next episode.